Oma suffix used for the benign tumor and sarcoma and carcinoma suffix used for the malignant tumor. In that, malignant tumor of all type of tissue except epithelial tissue is known as sarcoma and malignant tumor of epithelial tissue is known as carcinoma. Here I have prepared a chart to learn the classification of tumors easily. Let's look at it one by one. First type is a tumor of epithelial tissue. In that, first is a squamous epithelium. So, benign tumor of squamous epithelium is known as papilloma and malignant tumor of squamous epithelium is known as squamous cell carcinoma. Second one is a transitional epithelium. Its benign form is known as papilloma and its malignant form is known as transitional cell carcinoma. Third is a glandular epithelium. Its benign form is known as adenoma and its malignant form is known as adenocarcinoma. Fourth one is a basal cells of skin. There is no benign form existed in this type of tumor. Its malignant form is known as basal cell carcinoma. Fifth one is a melanocytes. Its benign form is known as melanoma and malignant form is known as melanocarcinoma. Sixth one is a hepatocytes. Its benign form is known as liver cells adenoma and its malignant form is known as hepatocellular carcinoma. Seventh one is a placenta. Its benign form doesn't exist. Its malignant form is known as choriocarcinoma. Eighth one is testicular epithelium. Its benign form doesn't exist. Its malignant form is known as seminoma. Second type is a tumor of non-epithelial tissue or mesenchymal origin. In that, subtype is a tumor of connective tissue. In that, first is a fibrous connective tissue. So its benign form is known as fibroma and its malignant form is known as fibrosarcoma. Second one is a cartilage or chondrocytes. Its benign form is known as chondroma and its malignant form is known as chondrosarcoma. Third one is a bone. Its benign form is known as osteoma and its malignant form is known as osteosarcoma. Fourth one is a adipose tissue. Its benign form is known as lipoma and its malignant form is known as liposarcoma. Fifth one is a mucin producing cells. Its benign form is known as myxoma. Its malignant form is known as myxosarcoma. Second subtype is a tumor of hemopoietic cell. In that, first one is a lymphoid cells. Its benign form is lymphoma, malignant form is lymphocytoma or it also known as lymphoid leukemia. Second is a myeloid cells. Its benign form doesn't exist. Malignant form myeloid leukemia. Next is a plasma cells. Benign form doesn't exist. Malignant form known as malignant myeloma. Next is a blood cell. Benign form doesn't exist. Malignant form is known as leukemia. Third subtype is a tumor of muscle cells. In that, first is a smooth muscle. Benign form is known as leiomyoma. Malignant form is leiomyosarcoma. Next is a striated muscle. Benign form is known as rhabdomyoma. Malignant form is known as rhabdomyosarcoma. Fourth subtype is a tumor of endothelial origin. Endothelium means epithelium of blood vessels. In that, first is a blood vessels. Benign form is hemangioma. Malignant form is hemangiosarcoma. Next is a blood vessel. Benign form is known as lymphangioma and malignant form is known as lymphangiosarcoma. Next subtype is a tumor of nervous tissue. In that, first one is a glia and benign tumor of glia is known as glioma and malignant form is known as gliosarcoma. Next is a neuron. Its benign form is known as neuroma and malignant form is known as neurosarcoma. Next is a meninges. Its benign form is known as meningioma and malignant form is known as invasive meningioma. Thank you so much for watching this video till the last. I hope you have understood the classification of tumor easily. You can check out my previous video regarding the tumor nomenclature and neoplasia introduction. Until then, take care. Bye bye. Say